So let's briefly take a look at phimosis. So phimosis is a condition where the foreskin, also known as the prepuce, cannot be retracted over the glans penis due to tightness or narrowing of the prepuceal opening. So you can see the foreskin here covering the glans penis, and you can see the narrow opening of the prepuce here. So the foreskin of this penis cannot be pulled back, and that's what is referred to as phimosis. You can see in the normal penis the foreskin has been pulled back, but here you can't. So you can also see a picture. You can see how narrow this opening is. You can see the hand putting effort to pull the foreskin backward, but it's very difficult. So what are the types? We have physiological phimosis. Here it is present in newborns and young boys. It is normal adhesions between foreskin and glans, usually resolves naturally with age. Then we have pathological phimosis. This occurs due to scarring or disease, such as recurrent infections, poor hygiene, inflammation, that's balanitis, trauma, or forced retraction. So we have various types of phimosis depending on the extent of the foreskin covering the glans penis. You can see the normal penis. You can see type 1, which the foreskin partially covers the glans penis. You can see type 2. You can see type 3, where the glans penis is quite completely covered, and you can see in type 4 where the glans penis is completely covered. So what are the causes? Poor genital hygiene, recurrent infections, that's balanitis, chronic inflammation, forced foreskin retraction in childhood, skin damages such as lichen sclerosus, diabetes mellitus in adults, and this increases infection risk. So what's the pathophysiology? Repeated inflammation leads to fibrosis of foreskin opening. This results to loss of elasticity, and this would cause progressive narrowing of preputal ring. This results to inability to retract foreskin. So what are the clinical features? Tight foreskin that cannot be pulled back, pain during retraction, ballooning of foreskin during urination, recurrent infections, poor urine stream in severe cases, pain during sexual intercourse, that's in adults. So what are the complications? Recurrent balanitis, that's glans penis infection, paraphimosis, that's an emergency condition, urinary obstruction, painful erections, increased risk of penile infection. Rarely there is increased risk of penile fracture. So what's the diagnosis? Mainly clinical examination, history of inability to retract foreskin, examination of foreskin tightness and scarring. So what's the management? We have conservative treatment. Here you maintain good hygiene, topical corticosteroids such as betamethasone, gentle gradual stretching exercises. Next is surgical treatment. Here you can do circumcision, removal of foreskin, definitive treatment for pathological cases, preputeoplasty, foreskin sparing procedures, which is less common. So what are emergency related conditions? So paraphimosis occurs when retracted foreskin cannot return, causes swelling and strangulation of glans penis, and it is an emergency. That's a medical emergency. So in summary, phimosis is inability to retract foreskin. We have two types, physiological and pathological phimosis. Treatment is by steroids and circumcision. Key complication is paraphimosis. So whenever you think of phimosis, you think of poor hygiene, hard fibrotic foreskin, infection, may require circumcision, obstruction of retraction, swelling during urination, and inflammation. Thanks for listening. Do not forget to like, share, and subscribe.